Hi, everyone. My name is Jean Lee, and this month's Gut Health is titled Getting Right to the Heart of the Matter. We'll learn about heart disease prevention by living a healthy lifestyle. As you may know, heart disease is the number one cause of death in the US for both men and women. More than 600,000 Americans die from heart disease each year. That's one in every four deaths. If you look at the map on the right, you can see high death rates from heart disease throughout the country. The term heart disease refers to several types of heart conditions. The most common type is coronary artery disease, which is a disease of the blood vessels. As you can see in the graphics, fatty deposits clog up the blood vessels and can narrow or completely block the vessels that supply blood to the heart and cause heart attacks. Other kinds of heart disease may involve the valves in the heart, where one or more of the four heart valves do not open or close properly, or a heart may not pump well and cause heart failure. Stroke results from damage to the brain from interruption of its supply by a similar process as the coronary artery disease, as we've discussed. Your doctor can determine the risk of heart disease by monitoring blood pressure and through blood tests to check on the levels of cholesterol and sugar in your blood. Ask your doctor about what tests might be right for you, and consider tracking your blood pressure if you're at a risk of high blood pressure. Now we'll talk about risk factors. Some of the risk factors that you cannot change include genetic factors, family history of heart disease, including race, male gender, and age. However, you can control smoking, diet, exercise, body weight, cholesterol levels, blood pressure, and blood sugar levels to decrease your risk of heart diseases. In a few slides, we'll be looking at each of the lifestyle practices that you can control and give tips for changes you can make to lower your risk of heart disease. So, the good news is that you can prevent heart disease by lifestyle changes, such as eating a healthy diet, maintaining a healthy weight, being active on most days, not smoking, and limiting alcohol use. There are many resources available for you to help you achieve this. Center for Community Health and Prevention offers lifestyle management programs that can support people in developing healthier habits. Please visit the website on the right lower corner for more information. The first lifestyle area that we'll focus on is our diet. A healthy diet is one of the best weapons you have to fight cardiovascular disease. What you eat and how much you eat can affect other controllable risk factors for heart disease, such as cholesterol levels, blood pressure, diabetes, and being overweight. Choose nutrient rich foods which have vitamins, minerals, fiber, and other nutrients but are low in calories over nutrient poor foods. Choose a diet that emphasizes vegetables, fruits, and whole grain, low fat dairy products, poultry, fish, legumes, nuts, and non tropical vegetable oils. And limit intake of sweets, sugar sweetened beverages, and red meats. CDC recommends adults to eat 1.5 to 2 cups per day of fruit and 2 to 3 cups per day of vegetables. Some of the easy ways to get more fruits and vegetables each day are to add a salad to your main meal, snack on cut raw vegetables, and substitute fruit for sugary desserts. Keep a healthy weight and active physical lifestyle. Physical activity can help you maintain a healthy weight and lower your blood pressure, blood cholesterol, and sugar levels. For adults, it is recommended to be physically active at least 30 minutes a day, at least 5 days a week, at least 150 minutes per week of moderate activity, such as brisk walking, running, swimming, cycling, dancing, and jumping ropes. Also, you don't have to do the entire 30 minutes each day at once. It can be broken down into smaller blocks of 10 minutes or more. So, for example, you could have two 15-minute sessions. Choosing activities that you find enjoyable and having an activity buddy to keep you accountable will make this time more fun and doable. Stop today smoking and alcohol. Smoking cigarettes or vaping and drinking alcohol involve addictive substances, and people often need the support of community programs to help them stop or use less of them. Cigarette smoking can damage the heart and blood vessels, and drinking too much can also increase your risk for heart diseases and heart attacks. Quit smoking today and get help from NewYorkSmokeFree.com or call the New York State Quit line. For drinking, drink moderately if you cannot quit altogether. Moderate drinking is defined as 1 drink a day for women and 2 for men. For support, consider joining your local AA meetings or get a counselor. In addition, Center for Community Health and Prevention's smoking cessation program is a great resource. Manage your stress levels. Although we can't avoid stressful situations in life, how we respond to them can increase or decrease our heart disease risk. Fortunately, there are many ways to help us manage our stress levels so they don't become overwhelming. Manage your stress levels by exercising regularly, as we've talked about. You could consider a nature walk, meditation, or yoga. Make time for friends and family. Get enough sleep, and that's about 7 to 9 hours for adults. Maintain a positive attitude. Practice relaxation techniques while listening to your favorite music. Or find a hobby. Try one of these today to help manage your stress levels. Please visit the Center for Community Health and Prevention website for getting support to lead a healthier life. For example, you could enroll in group or individual programs to lose weight, improve nutrition, manage cholesterol, get active, stop smoking, and reduce stress. References for this presentation are available upon request should anyone wish to learn more. Thank you for your attention and stay healthy.